All right, one area of improvement that I chose for my EQ self-assessment paper was conflict management. I got to follow a nurse lead in the STICU, and we saw a lot of conflict, mostly regarding staffing in the bed meetings. So of course a lot of floors would be short, and so all the nurse leads from the floor had to agree upon who would either float a nurse, get a staff member from registry, run short, or upstaff a nurse. So depending on what nurse leads were there, we would be able to come up with a strategy ourselves by compromising, but other times when no one could decide on what to do, the house supervisor kind of decided who would go where. I found that to be more helpful because sometimes we would sit and go back and forth on who would get who, and we kind of just never got anywhere. So having the house supervisor kind of just decide made the meetings go a lot smoother and quicker. And that way nobody had to fight over who got who. So through collaboration, we decided on who would float and who would get upstaffed, and seeing how they handle that conflict of staffing really helped me get an understanding on how to handle that kind of conflict. The other EQ self-assessment that I chose was time management. Time management was essential this semester. I work part-time, which is 2 12-hour shifts a week. Plus I'd have a 12-hour leadership clinical every week and a 6-hour community clinical every Wednesday. So time management was super important. So usually I started each week with making a list of what had to get done that week, and then I'd rank it in order of prioritization, and I did that every week. And then once the week started, I would make a list on what needed to get done every day that I had off, or what kind of worked with my work schedule and clinical schedule. And I think I can apply that method to my future job as a nurse, because I can make to-do lists for each patient, and I can kind of rank what needs done based on the acuity of my patients and my patients' needs. So moving on to the KSAs, I chose healthy teamwork and collaboration. Kind of talked about that earlier with the conflict management. But I participated in bed meetings, and we talked about the number of nurses on each floor, and we used collaboration to decide what nurses will float to which floor in order to have appropriate nurse to patient ratios on the floor. And the other one I chose was quality and safety. So in the STICU, there are so many alarms and so many tubes and all that, so safety is important. We would always put on the bed alarm, there was a ventilator alarms, there was an alarm set for heart rate, oxygen, and blood pressures. And then we would start each shift with bedside shift report, and so the nurses would kind of look at all the tubing, check the patient, make sure everything looked okay before they'd go home. And then as the nurse lead, we also checked all like the CPR equipment and made sure everything turned on, all the necessary materials were there in case something were to happen. All right, and then I will talk about 3 course outcomes that I met. The first one is the outcome 1.4. So I provided compassionate care to patients who were sedated and who were not able to speak or unaware of their situation. Even though they were sedated, we respected the patient and their dignity by talking to the patient as we did things, even if the patient could not hear us or they were not aware of what was going on. The other objective is 3.3. That objective, we completed bedside shift report along with using the SBAR guide to guide us in our report to make sure we didn't miss any important information. And we participated in evening and morning huddle. And then we checked all the tubings with the nurse leaving to make sure everything was intact. And I kind of talked about that in the quality and safety section as well. The other objective was 3.8. In that objective, we went to bed meetings to see the numbers of nurses throughout the hospital, and we determined if we would need to float a nurse, send a nurse home, or upstaff based on the numbers. We would then look at the date of when nurses floated last or got downstaffed last, and we would choose based on those dates. So lastly, 2 meaningful clinical experiences. I think it was a great experience to see what the nurse lead does on the unit. It taught me a lot on how to manage the nursing staff and manage tough situations. It also taught me teamwork. My nurse lead was always there to jump in when we'd get like an admit, or jump in when a nurse wasn't sure how to do something, and he would always answer questions. So that was helpful to see, because I think that's an important quality to have as a nurse. And then what personal goals I have met this semester. I got more comfortable in the ICU setting, which I've never been in before. And I know at the beginning of the semester I wanted to know if I would want to be in the ICU or not. And after this clinical, I would say no, the ICU is not for me. I can't really say why. I think I don't like how a lot of the patients are ventilated. I work on a med-surg unit, and I love to talk to my patients and get to know them, know their stories. And so in the ICU, when a patient can't talk to me, I find it sad. I don't know. I want to get to know my patient. So yeah, I don't know. I don't think the ICU is for me, but that's okay. I learned a lot this semester, and I can't wait to graduate and get out of school and just kind of figure out what I want to do. So it was a great clinical experience, and yeah, thanks for everything.